Yeah, no, it's a wonderful, personal journey. And obviously, your patients taught you every day to stick with this and the results you're
Yes.
seeing. And, we talked a lot about a lot of different conditions that people might be thinking, oh, or is biomagnetism a therapy that I should try for my own body? I, of course, see a lot of chronic illness, and there's this whole conversation about chronic Lyme disease. And you mentioned the, fungal and parasitic infections and heavy metal toxicity. And then we're all exposed to herbicides and pesticides and EMF and, all of these things. And so, do you feel that, with the chronic nature of the conditions we're seeing, that people, really to maintain their health, like, do we just have to continue to use biomagnetism to maintain our health? Or do you really see it as, curative and, people can get to this next level of health and ensure maybe for maintenance, but just kind of reframing how we look at these chronic conditions? You mentioned a really great example with the strep, and then kind of the imprint and the pH that it left behind that wasn't resolved, as well as the exposure that was going. So just, my goal here is to help shift the paradigm of how we think about these things in this conversation. So just maybe giving people more hope out there who might be struggling, with these complex chronic illnesses, and how this tool can be so helpful for them to regain their health.
Yes, absolutely. So this tool is, I would say, honestly, and of course it's going to be my experience because I've been doing this now for 11 years. Yet, with my knowledge of all the other techniques out there, I would say this is the one that really can unite them all, only because of the bioenergy aspect, where I can ask the body, is there an underlying nutritional deficiency? Is there an underlying toxicity issue? Is there an emotional issue? Does this require magnets to rebalance, et cetera, et cetera? And so the majority of the time, 9 out of 10 times, yes, the body will benefit from the magnets. And occasionally, or I would say, 8 out of 10 times, there are absolutely other factorial issues involved. Just like cardiovascular disease, we all know, has to deal with genetic issues, sedentary lifestyle, high cholesterol, hypertension, diabetes, smoking, etc. The majority of issues and conditions have to do with also underlying heavy metal toxicity, nutrient deficiencies, have to do with a low magnetic energy state. And so with the magnets, you can restore that state. Has to do with pH imbalance issues. Has to do with emotional issues. Has to do with other spiritual issues as well. There are so many different factors involved that through the use of the bioenergy work that biomagnetism requires, you can actually pinpoint which one is higher on the scale. And so you mentioned Lyme disease, which is what I tend to see the most of now. And so I do have a YouTube video out there where I talk about Lyme disease. And in my experience, Lyme isn't just about the Borrelia burgdorferi infection. It's about all the co-infections that are involved that, unfortunately, everyone is only thinking about, okay, maybe there's Babesia, or maybe there's Bartonella, or Mycoplasma pneumonia, but nobody's thinking about, is there underlying Epstein-Barr cytomegalovirus? Is there a fungal issue because of the overuse of antibiotics? And so there's candida overgrowth, and there are other yeast or mold toxicity issues. And are there other bacterial infections, such as an underlying tuberculosis or underlying Yersinia species infection, or underlying parasitic infections, such as malaria? And so I'm finding more and more that Lyme patients have underlying malaria. And so you would think, but wait a second, malaria isn't in the United States. How is that possible? No, it actually is, unfortunately. And so somebody goes down to the Caribbean or goes to Africa or India or Latin America and they're bitten by a mosquito. And then a week later, they come back to the U.S., but their immune system is strong and healthy. They were on vacation. Everything is status quo. But then 1 or 2 months later, their immune system dives. And that's when out comes the malaria or the Zika or whatever infection they acquired down there. And then they can be bitten by a mosquito. And then that mosquito takes in their malaria, and then it bites their neighbor or, somebody in Central Park who hasn't, flown out of the country. Now they have an underlying issue. So Bartonella can be spread through mosquito infections. Mm-hmm. And so people are being bitten by mosquitoes and black flies and green flies and all of these things constantly. And who's to say that a fly or a mosquito isn't biting a deer that has Lyme, and then that mosquito a week or 2 later bites a human? It now gave that human the infection from the deer or, whatever animal it had. And so, unfortunately, mosquitoes, flies are spreading a lot of this. And so when I apply biomagnetism therapy to these individuals, I find these layers of infections. And so in the first session, I'll get rid of, 1 or maybe 2 layers of infections. And then in the next session, I'll be able to see other layers that were underneath. And so our body is like this glass that it's able to withstand different inflammation, infections, imbalances, emotions, trauma, you name it, until it reaches its limit. Once it's reached the top, it will spill over. If it spills over here, you've got neurological issues. Over here, you've got musculoskeletal. Over here, digestive. Over here, sleep issues, hormonal imbalances. And so with biomagnetism, you can actually, through the bioenergy work, ask the body and be able to ascertain what the most important things are so that you can bring these levels back down so that the person will regain their health in the most optimal, efficient, ecological way. And so, is it about first addressing heavy metal overload issue? Is it about the nutrient deficiencies? Can you do them at the same time? Yes. Is it about the pH imbalance and low magnetic energy state? Absolutely. And so, once again, for me, it has been the overall unifying factor where I often have to tell the patients, look, in your particular instance, it's your, relationship with your husband or your children that's causing this underlying stress, which is causing a lowered immune system, which has allowed for this infection to take over. And so you can use these supplements to help raise, your nutrient status so that then your immune system can kind of kick in a little bit more, but you also have these heavy metal toxicity issues. So you want to take some chelators and antioxidants here, but you also have to work on, your relationship with your son or your daughter or your spouse, because that is what behind the scenes is bringing everything down. Mm-hmm. It's through the bioenergy work of biomagnetism that you can discover all of those things. And so you can place the magnets on different areas of the head that will help reduce the sympathetic nervous system, the fight or flight response that makes you be on edge and with anxiety and hypervigilant state, so that you can kind of bring things down so that, sure, what would normally set you off and put you in a state of anxiety or insomnia, all of a sudden you're like, it's not so bad anymore. Mm-hmm. And so it helps change your mindset when you can reduce all of that inflammation that you have going on in the brain. And so it's kind of like when we stay up late at night or we haven't slept well the night before, how do you feel the next day? You're groggy, you're cranky, you have a short fuse or short-tempered. Somebody could say hi and you're like, you bark. Mm-hmm. And so with biomagnetism during the sessions, you tend to feel very relaxed, very mellow, very just, you're in a sort of hypnotic state, yet you can also learn to maintain that through the placement of magnets to keep everything at a much more stable place energetically, or rather in terms of pH balance in your brain, in your central nervous system, in your muscles, joints, etc.